Hello, and thank you for taking the time to view my presentation. My name is Nadya Prood, and today I will be presenting on the role of law in promoting housing quality and stability. Research for this work was funded by the Robert Wood Johnson Foundation's Policy for Action program, and we thank them for their generous support. The focus of this presentation is to look at laws that aim to promote housing quality and stability and to evaluate their effectiveness. From our research, we found that there was a clear lack of research evaluating laws that were designed to promote quality, stable housing and thus promote health equity in housing. As such, we advocate for the adoption of a systematic experimentalist approach to develop, test, and diffuse legal interventions necessary to promote health equity in housing. By health equity in housing, we mean that people have the option to live in racially and socially economically mixed communities where all residents benefit from safe and affordable homes, good schools, access to transportation, parks and recreational facilities, and economic opportunities. Unfortunately, the reality in many communities across the United States is that there are not enough units, particularly affordable units, and those that do exist are not in the right places. In 2020, there are only 36 affordable available homes for every 100 extremely low-income households. This housing crisis has also disproportionately affected Black families. 20% of Black households are extremely low-income renters, while only 6% of white non-Hispanic households are extremely low-income renters. We know that law has played a role in creating many of these housing problems we have today, so we recognize that law must play a role in alleviating the issues. The goal of this research was to identify laws that aim to maintain and improve the safety and stability of existing housing and to assess the evidence of effectiveness of these laws. Because housing is such a complex system, we developed a systems model to organize these laws that we also refer to as legal levers. This system is made up of 5 domains, which you can see on this slide. For the purposes of this presentation, I'm going to focus on this domain because its goal is to maintain existing housing to be affordable, stable, and safe. Within this domain, here are some of the legal levers we identified. Once we identify these legal levers, we scan the scholarly and gray literature to learn about their effectiveness and impacts. In addition to scanning the literature for evidence, we also interviewed housing professionals to hear from people that are on the ground doing the work. If you're interested in learning about any of the other domains and levers, I will include a link to our report at the end of the presentation. After conducting our research, we found there was a lack of evaluations for legal levers we identified, and for those levers that did have promise, there was a lack of resources to scale them. An example of a promising law was the proactive lead inspections. In most parts of the US, code enforcement systems relies on tenant complaints. This is a problem because not only it exposes people to preventable harms, but it is also inequitable and possibly futile due to the barriers low-income tenants face to reporting code violations. In one city, Rochester, New York, they took actions to make their lead inspection program proactive rather than reactive. Rochester's law appears to be reducing lead hazards in rental housing without having a significant impact on the rental housing market, as well as contributing to the reduction in the number of children with elevated blood levels. More cities and states could experiment with laws like those in Rochester to see if they could be successful in reducing lead poisoning in their communities. A major barrier to scaling a law like this includes resources such as financial capital. The problem in the US is not necessarily the lack of money, but how it is spent. As mentioned earlier in the presentation, our research culminated in just one recommendation, since there was not much evidence on which to base more specific recommendations. Our recommendation is that policymakers, advocates, and funders adopt a systematic experimental approach to developing, testing, and diffusing legal interventions necessary to promote health equity in housing. With that as our starting point, we point to what we believe are the 6 most important policy changes to pursue right now. I have highlighted those that are most closely connected to promoting quality and stable housing, which are proactive housing code enforcement, such as the lead poisoning example I gave previously, and supporting residential stability. A few examples of legal levers that support residential stability are levers that regulate landlord-tenant rights, rent increases, evictions, and foreclosures. To achieve health equity in housing, the changes must be systematic. Incremental changes will not be enough to truly achieve this goal. It is important to remember that housing is a complex system, and all of these levers are interconnected. Adjusting just one lever could affect others, so we have to keep in mind that there is no one lever that is the answer. I will leave you with a quote from Eviction by Matthew Desmond. It is hard to argue that housing is not a fundamental human need. Decent, affordable housing should be a basic right for everyone in this country. The reason is simple. Without stable shelter, everything else falls apart. I would like to thank everyone for taking the time today to listen to my presentation. If you would like to learn more about anything I mentioned today, please check out our 6-part report series on legal levers in health equity and housing at the link on the slide. If you have any specific questions, please leave them on the discussion board or reach out to me directly via email. Thank you.